Thank you very much for inviting me. Now, I've had a little bit of a problem with this program, with this talk, because where does the dental issue start with aging? And I'm going to try and... So I've actually looked at it from birth to death, because I believe that the dentistry, the mouth changes with age. As Adolfo said, I'm based in Glasgow. My base hospital is actually the Queen Elizabeth University Hospital, but the Haemophilia Treatment Centre is Glasgow Royal Infirmary, where I do spend half of my time. I've got no disclosures. So, dental care is important for everyone. Care of the oral cavity whilst the teeth develop, care of the primary dentition or baby teeth, care during the transition to the adult dentition, care of the adult dentition, what happens when we lose our teeth, and also what happens with the medication that we get prescribed later in life. And one drug that we have a lot of problems with are the bisphosphonates, which Adolfo mentioned, and I will perhaps touch on that later. Now, unfortunately, I tried to get hold of the data from the WFH, but they changed the way they were presenting it, which made it very difficult. So I've used the UK data from 1971 to 2011, and really just to highlight the fact that the older population increases. So as you can see, 1971, very few over 60, but when we move to 2011, about 14% over 60. So there's been a shift in the population base. And this obviously has led us to a problem, because we now have to consider care of the elderly as well, because most people unfortunately were dying earlier on. So why are teeth important? Well, eating, smiling, talking. We can talk without teeth. Babies can make a noise, adults can. But if you talk to somebody, your phonation is better if you've got teeth. So the first tooth appears around 6 months of age. And the top photograph is of a child's dentition, what we would call a deciduous or a baby dentition. These teeth are important as they guide the adult teeth in place. They maintain spaces so that the adult teeth can form. You start to lose your baby teeth around 6 years of age. And the last teeth to erupt are the wisdom teeth or the third molar teeth, and this is around 18 years old. Now, these teeth should last a lifetime. If you look at the animal kingdom, an animal loses its teeth, it dies because it can't eat. We're fortunate that we can cook, we can sort of prepare food so that we can eat, but in the animal kingdom, if you lose your teeth, that's it, you die. So we do need to look after them. So what should a healthy mouth look like? And I'm glad in a way that this is before lunch, because I might put some of you off food. The gums should be pale pink and stippled. However, if you don't clean your teeth for 24 hours, and this is actually a clinician from Glasgow Dental Hospital who didn't clean her teeth for 24 hours and took a disclosing tablet. And I'm sure you can see the purple on the teeth. That's plaque. If that's not cleaned away, it develops further. You get marginal gingivitis, you get bleeding. And this is what happens when you brush your teeth. Now, I will show quite clearly, bleeding is not related to a congenital bleeding disorder. It is due solely to not cleaning your teeth. And this has been shown very clearly in the dental sessions this time. So, in early childhood, when can bleeding occur? Well, at any time during the eruption of teeth. We advocate the use of fluoride supplements as required. Now, there are certain countries in the world where we would not advocate it because there's sufficient fluoride in the water. So you do need to check. And even in the UK, there are certain areas where fluoride is naturally in the water. One area in particular is Nepal, where they have a very high fluoride coming off the Himalayas. So we wouldn't advocate that then. Introduce toothbrushing to your children as soon as the first tooth appears. And dietary advice, limiting sugars. And we need you to start visiting the dental surgeon early. The adolescent, well, you've got the change from the first teeth, the baby teeth, to the permanent dentition. And again, you've got the problem of bleeding as the teeth are shed. These teeth, as I say, should last a lifetime. Dietary advice becomes probably more important because these are the children who like to have their crisps, the snacks, the sweets between meals. And we try to say, have a meal and then you should have another meal and not have keriogenic foods between. Toothbrushing, fluoride supplementation, and continue visits to the dentist. So what are the causes of tooth decay? Well, sugary snacks and drinks. If you do want to have cola and things, use a straw because it will prevent it dissolving the teeth. The pH of cola and most of these drinks is quite low, quite acidic, so can actually dissolve it. And we have patients in Glasgow who have dissolved their teeth with fizzy drinks. If you're having liquid medicines, ask for sugar-free. Brush your teeth and gums using, if possible, if it's appropriate, to fluoride toothpaste twice a day, and visit the dentist every 6 to 12 months. Now, going to the older population, the incidence of caries in the over 65s in the UK is greater than the 14-year-olds. Why? Well, I think partially diet. A lot of these older people like their sweet foods. But you've also got a dry mouth, which may well be drug-induced. In haemophilia, you've got some manual dexterity problem. Not necessarily manual dexterity, but if you've had bleeds in your elbow or your shoulders, you may have limitation of movement. You can't clean your teeth normally. And as I say, they do like the sweets, most of these older people. And you get decay like this. This is difficult to treat if it's not looked after. And if it's not cared for, you can get things like this. This is somebody who actually is a mouth breather. They are on medication because of their heart, which dehydrates them, and this is mouth breathing, and because they don't look after the mouth properly, you get all of this. Periodontal disease, gum disease, again, the one on the left is just plaque and mobile teeth on the right. This will lead to huge problems, and it's painful. Poor care can result in respiratory tract infections, septicemia, septic arthritis. There's evidence of endocarditis, although that's a bit dubious. Good evidence of cardiovascular disease, and the one I've missed off is for diabetics, poor diabetic control. Improve the mouth, diabetic control improves. If you have dentures, because we now have a lot of our older patients are wearing dentures because they couldn't get the restorative treatment when they were in their 20s and 30s, so they lost their teeth, we have to look after the teeth. And this is what happens if you don't look after them. And there was one case in Glasgow where somebody didn't take their teeth out. They were in a care home, and they died shortly after we actually had to surgically remove the dentures from their mouth. So even once you've lost your teeth, you must look after the mouth. So it's a lifelong of care. And really, it goes round to this cycle here. If you've got poor oral hygiene, plaque develops, you then develop bleeding gums. Most patients then stop brushing their teeth because the gums are bleeding, and it increases, and you get a vicious cycle. Toothbrushing is the one thing which will break all these bits, along with the dentist and the hygienist. Now, I know in some countries you can go to the hygienist directly. In some countries you have to go via the dentist. That's obviously cultural and your own country. But bleeding in the mouth, which is probably the worst thing you can have, is related to poor oral hygiene and not, and I stress, and not a congenital bleeding disorder. Thank you. And a little plug for Glasgow.